Good afternoon, and welcome to my talk about personalized medicine to treat autism using generic off-label drugs at the Autism Challenges and Solutions Conference in Moscow 2021. Now, I'd like to introduce myself. My name is Peter Lloyd-Thomas. I have a master's degree in engineering from Imperial College in London. I have an MBA from INSEAD in Fontainebleau, France. I come from a family of doctors who were all taught that autism is untreatable. I'm not a doctor, but my son has autism, and I discovered after trialing a drug called Bometonide in 2012 that his autism does respond to drug therapy. And then I went on to develop a personalized polytherapy addressing further aspects of my son's autism. Again, all using existing drugs. Now, I share the research and my own insights via my blog called EpiphanyASD, and that's with parents, doctors, and even some researchers. Now, what is personalized medicine? Personalized medicine is very specific to the individual being treated, but personalized medicine is only part of an effective autism strategy, and the other part is personalized education. This might be ABA, it might be music therapy. There are many different educational strategies that do work in autism, but different people respond to different therapies, therefore you need some personalization. Now today we're just looking at the medical part, and the medical part does get very complicated, but you do not need to understand 100% of it to benefit from it. But if you're going to start thinking about giving drugs to your child, I think it's important to understand at least the basics, otherwise you won't be able to make an informed decision. If you want to go into further details, you're very welcome to read my blog, EpiphanyASD. So there we are, we're aiming for our place in the sun on the nice desert island where we benefit from both personalized medicine and personalized education. Now, it's very important to understand that all cases of autism are different. Now, they're different not only biologically, but they're different in terms of the symptoms that appear in that child. And also, those symptoms can and very likely will vary over time. So if you're a parent and your child is 5 years old, you can expect to see changes, some good, some bad, as your child ages. But at the bottom of this pyramid, impaired social and communication skills, and this is where people with Asperger's and severe autism share some similarities. But the more severe the case of autism, the more you get very troubling symptoms: cognitive dysfunction, epilepsy, self-injury, difficulty with fine and gross motor skills, and of course speech. Now, as I've mentioned, autism is not static, so you should expect the symptoms to change as the person ages. You should expect some symptoms to occur all of a sudden, like a tic, for example. You should expect other occasions where some external event causes the existing symptoms to worsen. Now, all this may seem bewildering, but it's all giving you little pointers of information to better understand your case of autism, so you then can treat it better. Now, for those of you who didn't study a lot of biology, you'd be surprised to learn that the human brain achieves its adult size pretty much by the age of 5. And in autism, where the brain grows too fast, it's even younger. So by the time you've been diagnosed with autism, your brain has almost reached adult size. But then what happens is all sorts of changes continue to happen inside the fully sized brain until the age of 25. So there are a lot of processes going on, and some of these processes are impaired in autism. Now, different processes are impaired in different types of autism, so it does get complicated. Now, when it comes to treating autism, there will be some therapies that are only going to be effective if given at a specific time. For example, there's a genetic kind of autism called tuberous sclerosis complex. It has an effective therapy, but it's really only effective if given to a child who's extremely young. And unfortunately, most people have aged out of this sensitive period by the time they're diagnosed. So autism is complex, and the more you understand it, the better you'll be able to adapt your therapy. So I like to think of it like this. So one of thousands autism. They're all called autism because they all share some features, but they're actually different. Now, which one is yours? Which of those thousands is your type of autism? So the more you know about autism and all different types, the easier it is to narrow down your specific variant. So at what point did this autism occur? Some children are clearly autistic, different from birth. Other children develop totally normally till, for example, 2 years old, and then they lose skills, toilet training, speech, that they'd already mastered. It's a different mechanism in play. You have to consider what comorbidities there are present. Some people with autism have terrible gastrointestinal problems. Some have none. Some have asthma. Some have eczema. All these are pointers. Another issue is how variable the autism is. I have one reader of my blog who's of Indian origin, living in England, but when he takes the family back to India, the level of autism is reduced. So there's something in his environment where he lives in England that negatively affects his child's autism. Then there's notable physical features, particularly in people with severe autism, with mental retardation or intellectual disability. There are differences particularly on their hands, faces. So big ears, small ears, one finger of your hand is shorter than the others. Specifically, you have a very short little finger. And also a very common difference is this size, weight, growth trajectory. So a baby who's born large grows rapidly for the first couple of years and then slips down the percentiles. So he might be in the 95th percentile for the first couple of years and then drop to the 20th. This is to be expected in autism because growth is accelerated in the early years, and then it reverses. Now, genetic testing, we'll come onto this in more detail later. This can be useful. There are also inborn errors of metabolism, which in good hospitals you can have investigated. And there's an extremely good web resource called Treatable ID, which lists all of the treatable metabolic errors in young children, telling you how to do the diagnosis and telling you what the therapy is. And then lastly and importantly, in understanding your autism is the family history. Is there a history of any kind of psychiatric condition, whether it's autism, schizophrenia, bipolar, or it could just be high IQ, because many of the genes involved in autism are also involved in intelligence and very specifically mathematical ability. So if both parents are doctors or one parent is a professor of maths, this would suggest a polygenic type of autism where you've got, if you like, too much of a good thing. You've got the clever genes, you've got too many of them, and then you had some environmental insult, maybe during the pregnancy, that moved the development towards autism. Now, another issue which is very important if you want to understand treating autism is the difference between medicine, which you'll get at your local doctor, and science, which you can read about in the literature. Medicine, not surprisingly, is based on old science, maybe 20 years old at least, if not much older. And modern medicine has evolved to apply a standardized approach so that whatever doctor you go to, you should get pretty much the same diagnosis and a similar therapy. And this is all based on diagnostic tests aimed at giving you a precise diagnosis. Now, this is all and well if you have a common condition. But if you have a rare condition or even a unique condition, there's nothing in the guidelines appropriate. So the doctor will just tell you the standard answer, which is autism today is untreatable, which technically it is. But if you read the science, you'll discover that much autism, at least features of it, is treatable. Now, how are we going to treat autism with medicine, drugs, if the doctors believe there are none? How could that be possible? The reason it's possible is that numerous drugs have got secondary effects, which currently, today, is a good thing. If you take an antibiotic and then you get an upset stomach, you're getting the secondary effect of that antibiotic. You're getting a bad secondary effect. But we can use these secondary effects, the good ones, in order to treat autism. I'll give you some examples, just antibiotics. So azithromycin, very common antibiotic, but it has potent anti-inflammatory effects as well. Penicillin, the original antibiotic, this increases something called GLT1, and this causes a reduction in the neurotransmitter glutamate. Now, many parents say their child improves when they're taking antibiotics. The important thing is they need to look at which antibiotic the child is improving under. And then you can look at the secondary effects of that antibiotic and figure out what is providing a benefit. So in some autism, there is too much glutamate, that's for sure. And glutamate is an excitatory neurotransmitter. And so reducing it, therefore giving a calming effect, reducing the neuronal instability, if you like. If penicillin is helpful, then we know you have too much glutamate. Or it's likely, at least. It should be investigated. Anti-parasitic drugs are extremely interesting. They have potent secondary effects. In the literature, they're mainly looking at potential cancer therapies because these secondary effects can be used to halt cancers growing. For example, mebendazole, which is used to treat a pinworm infection in young children. So it's a very cheap drug, very safe, been given for years all around the world, but it's also something called a WNT inhibitor. And this is potentially very beneficial to certain types of autism. Ivermectin is a PAC1 inhibitor, and a lot of research was carried out at MIT in the US, looking at schizophrenia and types of autism, and they were using PAC1 inhibition as the therapy model, if you like, but it hasn't been commercialized. Now, the very well-known drug at the moment in autism circles is Suramin, which is being developed by Dr. Navio in San Diego, and it's a purinergic antagonist, and it's used to treat certain kinds of parasites normally found in the central part of Africa, but it can only be given intravenously, so it has some drawbacks, and that is in development. Hopefully in the next 10 years that will be commercialized. Another example, which you won't read about, but is being discussed by some people on my blog, is this malaria drug called Malarone. Malarone actually contains two drugs. The first one is inhibiting purine synthesis, and the second drug reduces a protein called BCL2. Now, BCL2 is very relevant to cancer, and it's also very relevant to autism. So if you look at the research, if you look under BCL2 and autism, you'll find a lot written on this subject. Diuretics, which make you go to the toilet frequently, some of them have very interesting effects on the brain. So Bometonide, which I've been using for 8 years, it blocks transporter in the brain, and it lowers chloride in neurons, and this corrects a defect. Another one that's interesting is called Diamox. This affects many potassium, sodium, calcium, ion channels, and it has many uses. It can be used for treating tardive dyskinesia, as an example, but it potentially can also lower chloride within neurons in a similar way to Bometonide. And it has yet another effect. It affects how some drugs are excreted. So if taken with Bometonide, it increases the effect. It's called an organic acid transporter number 3 inhibitor. It's all very complicated. The reason I'm going into these details at the start is to show you that common drugs that have one effect have many other effects which your local doctor will not know about, and 99.9% of the population don't consider. We need to consider those secondary effects. So, having made it all sound very complicated, now I'd like to simplify it. So, autism is polygenic, meaning it normally involves many genes, and it's multifactorial. So it could be the environment that the mother is exposed to during pregnancy, a stressful environment, pollution, all kinds of things. Hormonal disturbances, she might have gestational diabetes, all kinds of things can combine with the genetic influences. So it's very complicated. It's very easy to get bewildered and you think, how can I possibly understand this? It doesn't matter, because these thousands of types of autism, they share many common aspects, and the science shows this. So you just need to treat, or try and treat, those shared aspects. So it might be the myelin layer being too thin. This might be caused for 100 reasons, or 200 reasons, but the therapy will be the same. So we're treating the shared features. We aren't trying to be too clever, saying we need to understand everything 100%. If we understand it 70%, that's enough. So there already are potential therapies for many of these shared features of autism. And then the aim is to put together a combination of these as a personalized polytherapy. So this is this chart. I produced this a few years ago, and it's my way of trying to simplify autism into one chart. And it doesn't include everyone's autism, but it does include many aspects that I think people can relate to. So channelopathies, nice sounding word. This just means ion channels not functioning correctly, and DEG is a differentially expressed gene. So if you don't know anything about genetics and ion channels, that's not going to mean a lot to you. But just bear it in mind. You'll see later on in the presentation that ion channels and gene expression, they keep reoccurring. Now, neuroinflammation. This, I think, is a word people can relate to. So where you have neuroinflammation, you have inflammatory cytokines elevated, and anti-inflammatory cytokines are reduced. And this has many effects. One of them is on these ion channels, NKCC1 and KCC2. It changes their expression in a bad way. In the brain, the immune cells, the only immune cells are microglia. And when the microglia are activated, they're in this state called M1. And this is not a good state to be in if there isn't currently a threat to the brain. But in autism, the microglia, the immune cells, are always on edge. They think there's an invasion going on. And this has negative effects because the microglia have got a lot of other roles to play. And they can't be playing those roles because they're anticipating an imminent threat. Then, of course, you have gastrointestinal GI inflammation. You have mast cell activation. Mast cells, these are the ones that release histamine. Then you have asthma, food allergy. These are all obviously immune conditions. And then this sort of chronic inflammation, it has an effect on synaptic pruning. This is where the brain, as it matures, it is rather like an ornamental tree. It has to prune itself so that to establish a functional form. So you don't end up with a very ugly looking tree. You want to have the strong growth encouraged, the dying branches, you just cut them off. In the brain, this is called synaptic pruning. And then you have myelination. This is best known in multiple sclerosis, where people lose the myelin over a period of years. But in autism, myelin is impaired, but to a lesser extent. All the genes involved in the process are misexpressed, and the actual thickness of the myelin is reduced. Now, moving on to oxidative stress. Oxidative stress, very popular term. You have all these younger people drinking their smoothies and juicing at home to reduce oxidative stress. Oxidative stress is a key issue in many kinds of disease. It's important in cancer, it's important in autism, and it's measurable. But there are triggers that make biological oxidative stress worse. Even emotional stress can make it worse. Toxic stress, even electromagnetic stress, and oxidative stress is an important part of mitochondrial dysfunction. We'll come on to that later when we look at regressive autism. And then the fourth general category relates to hormones and growth factors, because there are two basic types of autism. One has got pro-growth signaling where the volume is turned up, so it's hyperactive, and that's most of autism. And then there's a minority which is the opposite, where instead of pro-growth signaling being exaggerated, it's turned down. So the people with autism who have, when they're 2 years old, big heads, large brains, they're the hyperactive pro-growth type. The ones that are tiny babies with tiny heads, they're the other category, which is the rarer category. Specifically, the hormones that are effective, obviously the growth hormone, because that's what's causing the physical growth or lack of it. Thyroid hormones can be affected. So then you have, if you have a lack of the T3 hormone in the brain, then you get, effectively your brain is working slowly. like in a person with Alzheimer's, because in Alzheimer's you have a similar feature where you have basically the brain is powered down. And so one of the therapies investigated for Alzheimer's is to actually use intranasal insulin to treat Alzheimer's as type 3 diabetes. That is still, I think, decades away from being implemented. Serotonin, this is a hormone that's very important to how you feel, and also its receptors appear to be misregulated in autism, and particularly in Asperger's. It seems if you have Asperger's, serotonin and its receptors is what you really need to concentrate on. So oxytocin, vasopressin, we'll come on to them a bit later. They're also very relevant. So in a typical child with severe autism, like my son, all of those 4 categories are important. And you need to address what's going wrong in each of those 4 to produce your optimal therapy. So this optimal therapy, this personalized therapy, many therapies already exist. Some of them are very cheap, like Bometonide, Diamox. These are cheap. But they're drugs, they aren't supplements. On the internet, 99% of people are trying to treat their case of autism with supplements, herbal remedies, homeopathy. But if you have a severe case of autism, you will need to treat it with drugs. And these drugs are hard to access in most countries because most doctors have been taught that autism is untreatable. Now, in Russia, you have some very interesting drugs unique to this part of the world. I listed some here. Pantagam, very interesting, and you have many people in Western countries buying it from Russia. You have meldonium, which I think really should be investigated as a therapy for mitochondrial dysfunction in autism. It hasn't been. You have a very interesting antihistamine called Inborn, which again improves mitochondrial function, so should be interesting. And then you have many nootropic drugs. So these are drugs given to people to improve their IQ. One of them is called Tenoten, and some of these are over the counter. They don't require prescription. Now, when it comes to the literature, most of it is from America, and this long list of drugs, these have all been trialed at least once, and some of them many times, in what are called randomized double-blind placebo-controlled studies. So these are the Rolls Royce, the best studies you could possibly have. It's a long list of drugs, most of which you've probably never heard of. And then many other drugs have been trialed in small studies. These are studies where perhaps they gave them to 5 children and they monitored the performance. There wasn't a control group who were given a placebo. And then there are published case histories in the literature where the author will talk about one specific case of autism and how it was treated with one specific drug. So there is a vast amount of information available. You just have to look for it. Now, once you've read all that research, or at least part of it, you'll probably, if you're like me, you'll come up with other ideas. So, well, why hasn't this piece of research been translated into therapy? Why hasn't it been trialed? And I have quite a long list there. Some of these were my ideas, some of them were just completing other people's ideas. So low-dose clonazepam is Professor Catterall's example, which he tried in several genetic types of autism, but didn't take the next step of applying it to humans. Now, this all sounds like a lot of work. So why would a parent go down this road? What the point is that if you don't do anything, you are guaranteed failure. This is what I call the risk of doing nothing. Now, the alternative is to do something. And what's the risk of trying some of these drugs and other therapies? The risk seems to be trivial because young children are not the ones that get side effects from drugs. It's old people. So if you give a statin to an old person, a certain percentage, maybe 5%, will start complaining about muscle pains and so on. Younger people are much more robust, they're much healthier, they tend not to have any negative effects. But on the positive side, if you have the right therapies, you can expect to improve cognition, measurably raise IQ, and reduce the severity of autism. Now, in each person, the most troubling symptoms, they vary. In one person, the troubling symptom is self-injury. In someone else, it's a tic. In someone else, it's the fact they can't talk. So there's no uniform therapy that you can ever apply to autism. Now, in terms of data, I showed this at the last conference I presented at. This is a study based on a longitudinal study. So it's following young French children with autism from diagnosis all the way into young adulthood. Now, in this long-running study, the children basically fitted into two groups. The large majority, 80%, their skills, these are daily living skills, so brushing teeth, tying shoes, self-care, toileting, making simple meals. The majority, at 80%, at the age of 22, they had the living skills of a 3-year-old, which really does not set them out for a good, happy future. And then the minority, 20% or so, they were in the high growth group, and they ended up continuing to learn. There was no plateau of learning, at the age of 6. They continued to grow in terms of knowledge, and even this rate of skill acquisition increased during the late teen years. So they ended up at the age of 22 with the living skills of someone with 180 months. The y-axis is done in months. So 15 years old. So you're 22 years old, you've got the living skills of a 15-year-old. That's pretty good. I think many parents would accept that. The problem is the majority of children don't reach that. They're in the red group at the bottom. Now, what we want is children with functional skills. So, my son at the age of about 14, riding bicycle, he can ski, he can even go over ski jumps. Now, none of that was expected. So how did I get to there? I'll now start talking about specific drugs. The first drug is called Bometonide. Now, in at least 30% of severe autism, there is an error that occurs that it permanently leaves neurons in an immature state. And in this immature state, there is this excitatory inhibitory imbalance, which all sounds complicated. What it means is this developmental, what it means is this step that should have occurred in the first few weeks of life never occurred. And then it's rather like a car with 2 accelerator pedals and no brakes. Because GABA, one neurotransmitter, is supposed to be if you like, opposing another one called glutamate. GABA is meant to be inhibitory and glutamate is excitatory. And then in the people that respond to Bometonide, GABA got stuck. And so GABA and glutamate are both excitatory. So your brain is totally out of balance. Now, how you correct this, you can correct it with a very old diuretic drug called Bometonide, which has a secondary effect. So it's a diuretic because it affects a transporter called NKCC2, but in the brain, it's affecting NKCC1. And we need to block it and reduce the flow of chloride into neurons. Now, I imagine in the next few years, hopefully by 2025, Bometonide will be approved in the European Union as an autism therapy. There are other ways of lowering intracellular chloride. I discussed these in my blog. There's a very old drug called potassium bromide, and this was the original therapy for epilepsy, going back 150 years ago. What it's doing, it's replacing chloride ions by bromide ions. Azoximide, Diamox, which I also mentioned earlier, that has a similar effect. And there are other drugs, even coffee. Chlorogenic acid you'll find this in coffee. This is an OAT3 inhibitor, and this increases the effect of Bometonide. So what's the point of all this therapy? Well, if you're a responder to Bometonide, you can expect to improve your IQ, mood should improve. The common description from parents tends to be more present. So instead of just being physically present in your surroundings, you're now cognitively present. It's as if the fog has lifted, and it's a very significant change. So I came to Bometonide when I saw this clinical trial in 2012. If you look on the right, this is the effect of Bometonide. So day 0, you had this score of about 42 on the childhood autism rating scale, and then it drops by 6 after 90 days of therapy. And then when you stop therapy, after another month, you get to day 120. The autism severity has increased, but hasn't gone all the way back up to where it started. So I saw this chart, I asked about Bometonide, and then within a couple of weeks, I started my trial. So this rating scale, for those who are interested, if you're 37 and above, it's severe autism. If you're 30 and above, it's autism. So 30 is the cutoff. Below 30, you're not counted as having autism. And in the French study, they were dealing with people with severe autism. Now, a very interesting supplement this time, N-acetylcysteine, NAC. This was trialled first by Professor Harden at Stanford and subsequently by many other people all over the world. And it's using this common chemical to treat oxidative stress. Now, oxidative stress, you actually can measure it in a blood sample. And it's present in almost everyone with autism. And it's present in almost everyone who has some kind of sickness. So someone with cancer, someone with dementia, most people over the age of 50. But oxidative stress shouldn't be present in children. And for many people, the most noticeable effect is a significant reduction in stereotypy, stimming. Sensory overload. This is something parents are very familiar with. Overload from sound, light, smell, any of the senses. Now, interestingly, potassium, something simple as that, appears to have a significant beneficial effect. You can't continue to raise your level of potassium. That's not safe. But you don't want to have a low level of potassium, and you can quite safely take small doses of potassium, 2 times a day. And anyone using Bometonide as a therapy, they have to take potassium supplements. The interesting thing to note here, the potassium in a supplement doesn't have quite the same effect as potassium in food, so like bananas. The reason is, if you eat a banana, it has 800 milligrams of potassium, but it very slowly enters your bloodstream. Whereas if you drink 800 milligrams of potassium supplement, it's there within 15 minutes. Sensory overload is more complicated than just having more potassium. Now, there is a science-based therapy. It's being developed partly in Yale, where they're looking at treating sensory gating, and also in Maastricht, where they're trying to improve cognition. But it's the same therapy. They are blocking HCN channels. And you can get this effect using an existing drug, a PDE4 inhibitor, and the one used in the Dutch research is called Daxas, or roflumilast, and it's normally used for treating chronic oppressive pulmonary disease, or severe asthma in effect. And a 1/5 dose has remarkable effects in the brain. So the people with autism who get very upset by sounds like a clock ticking or noisy chewing may experience a significant improvement from this low dose of Daxas. And the similar mechanism might explain why so many people with schizophrenia and some people with Asperger's feel much better when they smoke, because nicotine is another HCN channel blocker. And we've just been talking about potassium in the previous slide. Potassium ion channels, they also affect these HCN channels. So the research shows that very small dose, it's 100 micrograms of roflumilast, can have positive effects on sensory gating. This is what's not working in the child who doesn't like the clock ticking. The child should hear the first tick and say, it's a clock. It's meant to make that noise. But in the person with autism, that continued noise, tick, 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 drives them crazy. And you can measure this. It's called P50 sensory gating, using an EEG. So child is wearing the headphones, and you're measuring the brain activity, and you make these repeated sounds, and the brain should be alerted by the first sound, the first tick. Oh, what's that sound? But then you then realize it's a clock, it repeats, and then the next tick and the following one, gradually, you shouldn't react to it. It should just fade into the background. But in many types of autism, this sensory gating, and when it's to do with sound, it's called misophonia. This is extremely troubling to people. So this low dose of roflumilast is an interesting therapy. I mentioned statins earlier, and I also mentioned this BCL2, because you might remember there's that anti-malarial drug called Malarone, and one of its effects is on BCL2. Well, atorvastatin is taken, I think it's actually the most commonly taken cholesterol lowering drug. But atorvastatin also has effects on several autism and cancer genes. It affects P10, RAS, BCL2, and also WNT signaling. And if you recall, I mentioned the other anti-parasite drug, mebendazole. It affects WNT signaling. So we have this interesting statin. It does reduce incidence of cancer. The reason being it affects these cancer pathways, but the cancer pathways overlap with the autism pathways. Now there's more than one statin. The statin that is effective in Fragile X, but only in mice, is lovastatin. And then there's single gene autism called Smith-Lemmy-Opitz syndrome, SLOS. Now, this causes severe autism, but it is treatable. It's treatable by giving the child cholesterol plus simvastatin. And you might think this is strange, giving a cholesterol-lowering drug to someone who has low cholesterol, because the dysfunction in this SLOS syndrome is caused by not enough cholesterol in your brain. But simvastatin affects the very specific gene called DHCR7 that causes SLOS. So if you have mutated copies of this gene, you will have this type of autism. Simvastatin increases the expression of this gene whose protein you're lacking. It's a bit complicated, yes, but these very common drugs have additional functions. So in my case, I chose, having read the research, I decided to use atorvastatin, and it has a very pronounced effect from the first dose on what I call cognitive inhibition. This is where the child knows what to do, they know how to carry out an activity, but they're kind of frozen. They don't do it. So they can do an activity, but they almost have to be dragged physically to do it. My example of that is my son, who learned to play the piano. And when he was from the age of about 9, and he wouldn't play the piano unless the teacher was sitting next to him. He wouldn't so he couldn't practice. He'd have the lesson and that was it, never play. The first day, or one day after taking the first atorvastatin pill, he just came to the piano, started playing. And there were other effects like this. So like, we live in a house with bedrooms upstairs, living area downstairs. He wouldn't be able to come downstairs from his bedroom. You'd have to physically hold his hand and take him down the stairs. But that all disappeared after taking atorvastatin. You know, he no longer needed to be assisted. He could just, if you like, he's no longer frozen. He could actually fulfill his potential. So microdose clonazepam, this has a very subtle effect. And again, it's on this excitatory inhibitory imbalance, EI imbalance. Now this is a common feature of very many types of autism, but there are different causes. So in the people who respond to Bometonide, they may just need Bometonide. There are other people for whom Bometonide will do nothing, but they still have this imbalance between the different neurotransmitters. So low-dose, microdose clonazepam is another potential therapy. It's a very safe therapy because the dose is microscopic, 0.6 micrograms per kilogram. Now, clonazepam, it's a very common drug, it's a cheap drug. At the normal doses, it has some negative effects. You don't want to be taking normal dose clonazepam for years and years. It is not good for you. But we're talking about a dose less than 1/15 of the regular dose. So one pack of clonazepam it will last you, 2 or 3 years. It's the dosage that small. Most of the people I'm aware of have used it actually have been doctors treating their own child. Verapamil, another very common drug, which is normally thought of as a L-type calcium channel blocker. So remember my graphic at the beginning with those ion channels and differentially expressed genes. Now, the interesting point here is this drug, yes, it affects these calcium channels like this one, CAV 1.2, but it affects numerous other ones. Some of them are calcium ion channels, some of them are sodium, and some potassium. Now, this drug, which is normally given to old people with high blood pressure, originally there was an attempt to repurpose it to treat irritable bowel syndrome. And that drug was going to be called Resolar. That is interesting because many people who've taken Verapamil for autism have found that it has solved their stomach problems. So the child who's permanently with diarrhea, and they've started Verapamil trying to treat anxiety and self-injury, and magically his GI symptoms have disappeared. There is some logic, and that's why this drug was originally Resolar being developed. And our Verapamil is called an isomer of Verapamil. So that's like a left hand and a right hand. So chemically, our Verapamil is the right and the left are the same, but actually they're mirror images. And for many drugs, only one, if you like, mirror image has the pharmaceutical effect. And when you buy the drug at the pharmacy, you're getting a mixture of left and right-handed. Now, these ion channels, the L-type ones, they play a role in allergy. And many people with autism have substantial allergy problems. And also, many people with autism have epilepsy. And the calcium channels, sodium channels, these play a very important role in seizures. But these ion channels are interrelated, and like the good thing is that one drug affects many of them. So you don't need a specific drug for every ion channel. Timothy syndrome, this is another single gene type of severe autism, and that's caused by a dysfunction in this CAV 1.2 gene. So I found Verapamil to be effective for anxiety and self-injury triggered by allergy. So this is where you have summertime raging, and it's linked to allergy. And it's a near total solution. Interestingly, in 2019, there was a study published with data going back 10 years from Sweden with 140,000 people. And it showed that of those 140,000 people, the ones who by chance were taking an L-type calcium channel blocker, they engaged in much less self-injury than the people who by chance were not taking that drug. So this was not a trial of the drug, it was just an observation that the people who happened to be taking this drug were not engaging in self-injury. So Verapamil, at least in some people, can be very effective for treating anxiety and self-injury. Now, I know some of you probably think the presentation's already got very complicated. I just want to show you a chart that shows the interrelation between these channels. Really just to show you that one drug can help many different types of dysfunction, but based on some science. So here we are. These are genes that encode some calcium ion channels and some sodium channels. Where it says SCN, that's sodium. Where it's CAC, it's calcium. And this chart is showing the interaction between these genes. Now, almost all of these genes by themselves, if mutated, can cause autism, and also they can cause epilepsy. So if you just have one of these genes mutated, you'd get a problem. What happens in autism is that for most people, they don't have a mutation in this gene. The machine is misexpressed. So going back to the chart at the beginning with those channelopathies, and remember DEG, differentially expressed gene. If you have one of these genes misexpressed for some reason, it affects the expression of all the other ones. And this cascade of effects then may cause autism. So just one gene misexpressed, you can live with it. But the problem is there are interactions with all these other genes, and then you're further burdening the brain with these dysfunctions. The good news is that many drugs, in fact most drugs, that affect an ion channel affect several. So the verapamil drug that my son responds to might be responding because CAV 1.2 is misexpressed. But in the other child with autism, it might be the sodium channel. We don't know. But equally well, we don't need to know, because if it works, it works. The important thing is it safe and is it effective? Now, sulforaphane, this intervention, this is broccoli sprouts. This has been researched at Johns Hopkins for decades, and they've been looking at it to reduce cancer originally, and they showed that yes, it is therapeutic. And so if you live in China and you have very poor air quality, this is going to increase the prevalence of certain cancers, but that can be remedied by, well, either clean air, or they were suggesting using sulforaphane. It's also specifically considered for certain types of cancer, prostate cancer in particular. And then in 2014, they made a trial for some reason in autism, and they found that there was a positive effect. Now, sulforaphane, it's not stable at room temperature. So the idea was that you eat broccoli, and as you eat the broccoli in your mouth and you're chewing it, you have a chemical reaction going on with this enzyme called myrosinase that produces sulforaphane, which is then measurable in your blood. I would have hoped that after all these years, there would be a sort of conclusion to this research whereby there would be an approved therapy, but there isn't. There are a lot of supplements available of varying qualities, but you don't need a prescription. So this, I think, makes it popular. In my son, when he was young, it had quite a profound effect. It produced euphoria. It made him start laughing so much so he would go to the bathroom and look in the mirror to watch himself laughing. In many people who've used it, they find it improves mood and speech, but the effect decreases over time unless you increase the dosage. But the medical conclusion of sulforaphane, I think, is that it doesn't have a big effect. But I certainly had feedback on my blog from parents who found it highly beneficial. So it's, you know, you can try it and see. Agmatine, this is something which I use, and in the research it is proposed as a therapy for all kinds of psychiatric disorders. But when it comes to autism, other than my blog, there's really no talk about it. But Agmatine is a cheap supplement which has a very positive effect in people who have autism and they're a bit lethargic. I get lots of people writing to me saying, Peter, my son's got ADHD and autism, what should I do? And I kind of say, well, how old's your child? Oh, my child's 3 years old. Well, when my son was 3 years old, he was jumping all over the place. But I didn't call that ADHD. I think you're jumping all over the place because your brain isn't functioning properly. You don't know what to do. And that's the result. And by the time he was a little bit older, he was pretty lethargic, mentally and physically. And then I did this brief trial with Agmatine, which is a cheap supplement, just use about 1 gram of it. And it, in the science elite, it boosts endothelial nitric oxide synthase. So it increases the amount of nitric oxide, and this will increase blood flow in effect. And it had a remarkable effect both on physical and mental stamina. So instead of on school activities, physical activities, him being last, he'd be up there with the leaders. And I have similar feedback from other parents. But again, I must emphasize that autism is not static, because one of the parents who now uses Agmatine, he tried it a few years ago when the child was younger, had no effect whatsoever, didn't notice anything, and yet he was complaining about how lethargic his son was and how he can't keep up, they can't go for walks, he always wants to sit down. 1 little scoop of Agmatine in the morning, and he's a new person. And so the example I give is the Duracell bunny, where if you don't have the alkaline battery, you lack stamina. Clemstine. This is another very cheap, interesting therapy with plenty of science behind it. So Clemstine is normally used as an antihistamine, so treating pollen allergies. But in the research, it has 2 very interesting effects. It suppresses M1 activation of microglia. If you remember at the beginning of the presentation, I was talking about neuroinflammation, and I said the microglia, these are the immune cells of the brain, and they're stuck in this M1 state where they're constantly anticipating a threat, which is not good. One effect of Clemstine is that it suppresses this activation and shifts the microglia back to M0, which is the resting state. And then there's a separate effect on myelination via P2X7 receptors. So these are the purinergic receptors. And again, go back to the earlier slide, Suramin, which is the great hope, I think, for autism, that is also affecting a broader range of these purinergic P2X7 receptors. And in a recent study, in different mouse models of autism, they showed the misexpression of the genes that are involved in this myelination process. So these are called oligodendrocytes. And on MRI, you can actually measure how thick the myelin is in the brains of people with autism versus typical people. And we know there is reduced myelin coating. So Clemstine has already been proposed and is in trials as a therapy for multiple sclerosis, but at such high doses that it causes some sedation, makes you sleepy. Surprisingly, at least surprisingly to me, people with depression, they have impaired myelination. Here's this nice graphic. So you see the unhappy mouse on the left, and you can see how the myelin process works. So the yellow cable, nerve fiber, that's the axon, and then you have this oligodendrocyte with little arms coming out. and this creates the myelin layer. This is this white kind of insulation. And then one effect of Clemstine is it makes those oligodendrocytes work harder. So instead of the 2 pieces of myelin, you've got 4 produced. So I thought this should be beneficial, or could be beneficial, in people with impaired myelination. And it does have an effect in at least some people with autism. And it's quite a sort of subtle effect, because you'd think people with poor motor skills, and they have poor motor skills because those circuits haven't been myelinated, they haven't been made permanent. You'd think that giving those people Clemstine might improve the motor skills. But in the people that gave me feedback, although these are parents of older children with autism, it was cognitive changes. In my son, he seemed to start expressing opinions, which he hadn't done before. And this isn't always positive, because there may be negative opinions. It's, I don't want to do this. But he would give an opinion rather than an automatic answer. So, for example, if I said to my son, do you want ketchup? He would just say yes. Whereas now, he might say yes, he might say no. Do you want ice cream? Previously, yes. You'd always have a yes. And now, often it is yes still, of course, but you'll get a no as an answer. That's quite a profound change, because many people with severe autism, they're operating at a quite low cognitive level, where they're getting up, they're eating, they're being helped to get dressed, to wash, they go to the toilet, they might need help to do that, they're eating again, they're having a shower, they might do that independently, they might need supervision, they go to bed. I mean, that's life, nothing very sophisticated. But if you improve brain function, then you can start getting the sort of behaviors and activities which we'd consider typical. Now, I was asked to include a lot of detail in my presentation, so it does go on. So calcium folinate, which in the US they call leucovorin, this is another interesting intervention. This is based on the fact that 75% of people in the research who have autism have low levels of folate, so vitamin B9, inside their brain. The reason for this is they have antibodies in their blood which are reducing the flow from the rest of their body into their brain. So these people have no shortage of vitamin B9 in their diet, it just can't get into their brain. And folate is critical to many processes going on in the brain. The good news is that low levels of folate inside the brain can be corrected by taking large doses of folinic acid as a drug. Another interesting point is that one of the pioneers of this therapy, Professor Ramakers in Belgium, is now treating parents to avoid autism in their future children. Because what he found is that not only did the child have these antibodies in their blood, but so do the parents. So therefore, he considered the fact that when the fetus is in the mother, it is probably being damaged by the fact that the mother has these antibodies. So in his therapy, he gives the mother and the prospective father, before conception, calcium folinate. And then he's following them through the pregnancy and then afterwards, and so far with success. So what's happened here is the parents have had one child with autism, and they're thinking, I don't want to have a second child with autism, what can I do? And one option is ensure there's no shortage of vitamin B9, which sounds very simple, but it seems to be effective. And the great majority of people with autism share this feature. Now, In the clinical trials and in the literature, you'll see Dr. Fry's name, and he appears at many of conferences like this. In his work, he's suggesting that improved speech is the primary outcome to look for. And in many parents, improved speech is the thing they're dreaming to happen. So I think a trial of calcium folinate is a good idea. Now, ideally, you do the blood test to see if you have the antibodies, which you can do, but the test takes place in the United States. Now, I mentioned hormones. Oxytocin is a sort of well-known hormone, emotional love hormone. Vasopressin, much less well-known. The two hormones are very similar, but chemically, biologically, they are interrelated. Oxytocin is very interesting because when a mother gives birth, naturally, as she's giving birth, she produces this surge of oxytocin that crosses to the baby. And one of the purposes of that, as well as making the delivery process go better, it triggers this GABA switch, which lowers chloride within neurons in a process that lasts a few weeks. Now, if you recall earlier in the presentation, I was telling you about this excitatory inhibitory imbalance and this drug called Bometonide. Well, if you don't have the oxytocin at birth, this process, when the neurons switch from being immature to adult, if you like, doesn't happen. This is one reason why children born by caesarean section have an increased likelihood of autism. And it's another reason why children born by caesarean, maybe they should be given oxytocin at birth to give the same effect. But of course, not everyone with caesarean section has autism, so there's lots of factors involved. Oxytocin plays a key role in emotional bonding, and this is one area when many people with autism suffer. They don't have emotional bonds or very weak ones. Vasopressin also plays a role in social behavior and also in the negative aspects, in aggressive behaviors. And many parents struggle with aggressive behaviors in their child with autism. The good news is that both oxytocin and vasopressin themselves, just a synthetic version of those hormones, are seen as potential autism therapies and are involved in ongoing trials. Oxytocin is interesting because, on the one hand, you can give it to a child or adult intranasally. You give them a spray and they squirt it up their nose. But interestingly, some probiotic bacteria, which you can just take as a tablet or as a drop, they produce an effect in the gut, which then triggers oxytocin release in the brain. And this has been shown in the science. It's quite remarkable. And the good news is that you can buy these probiotics because this BioGaia Protectis is sold as a probiotic for babies to give them, stomach, to give them so they don't get colic, stomach pains. But it has another effect of making oxytocin. And if you give this to a person with autism, you'll see them becoming all emotional afterwards. It's quite remarkable. Vasopressin, this is being a little bit further away, I think, as a therapy. Vasopressin is being developed at Stanford, and they're just using an ampule of vasopressin and then putting it into a nose spray, squirting it up your nose. And this seems to have effects on people from mild to severe autism. I thought it would just be helping people with Asperger's, but no, it seems to have effects across the range. Interesting thing is there is a existing nasal spray, in most pharmacies. Minirin is called. It contains something called desmopressin. So you don't have to make it, custom made. In Stanford, they're using a spray which is made specifically for them in the hospital pharmacy. This product, desmopressin, is a off-the-shelf product. And one reader of my blog was prescribed this for her child by the neurologist, not expecting it to affect autism, and it had a remarkably positive effect. So desmopressin, very interesting. Now in the trials, the people who benefited the most from the therapy are the ones who have the highest level of vasopressin in their blood, which is perhaps the opposite of what you might expect. Also in the trials and in the research, the effect may be different in males versus females. Some people, it has a profound effect. One note of caution is that vasopressin affects diuresis, as does Bometonide. And if you take both drugs together, you may suffer from low levels of sodium, hyponatremia, because you'll drink more fluids, and vasopressin specifically affects loss of sodium. So if you were to take vasopressin with Bometonide, you need to monitor your level of sodium and possibly take a sodium supplement. Other useful information that's come from my experience of my son's autism and all the readers of my blog. This is summertime raging, wintertime raging. So many people, including neurologists, are aware of this phenomenon called summertime raging, where crazy stuff happens, but only in the summer. So in my son, this happened, and I traced it back to pollen allergy. When we went in the summer to the mountains, the behaviors disappeared, come back home, and the bad behaviors return. So this is an allergy-driven phenomenon causing anxiety, and anxiety accelerates to aggression, self-injury, and really terrible behavior. And I tried all sorts of therapies, mast cell stabilizers, listed here, but the real magic silver bullet was verapamil, which is the calcium channel blocker. Wintertime raging, this also occurs, and in many people it coincides with the very slow loss of milk teeth and the eruption of permanent teeth. And you might wonder how this could be, because is it toothache? Is it pain? No, it's not pain. It's the body is reusing the same cytokines, the same messengers for different purposes. So IL-6 is a very important inflammatory cytokine, but it's also used by your body to signal to your teeth that it's time for a change. So the milk teeth, the roots have to dissolve, and then the permanent teeth pops up. So if you treat with ibuprofen, super simple drug, this wintertime raging can be dramatically improved. And many people have subsequently contacted me and told me the same thing, that during this really slow process, or it seems to go on for years, of changing teeth, that behavior gets much worse. Now, PANS and PANDAS, if you follow the internet, this is a very popular subject with parents. So I'm looking here at PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. So in the case of my son, age 13, after a mild infection, he actually went to England for Christmas, and he had these really, really prominent verbal tics. So he was going like, blah, 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 they weren't even words, they were large animal-sounding noises. And this had never occurred previously. Now, this was treated with 5 days of prednisone, which is a steroid, as if it was a PANS exacerbation. And then the symptoms just faded away over a 2-week period, never to recur. But 2 years later, another tic appeared. This time it was an eye-blinking tic. And having checked it wasn't an eye problem, this was treated in the same way. And the problem resolved. And then I was just recently contacted by a neurologist who's a mother of a child with autism, and she was telling me child had been given a flu vaccine, and shortly thereafter started demonstrating these really strange tics, basically. And in the country she lives, Pandas, it doesn't exist as a medical diagnosis, but nonetheless she treated it promptly, but with ibuprofen, not with a steroid, and the symptoms faded away. So what's happening? Well, you have this condition called autoimmune encephalitis, or encephalopathy, and this refers to a condition when the immune system, by mistake, is attacking healthy brain cells. And this causes a cascade of effects. Now, if NMDA receptors are affected, you can get hallucinations, and then you can be diagnosed with schizophrenia. You can end up in hospital, emergency care for schizophrenia, but you haven't got schizophrenia. You have this NMDA encephalitis, which is treatable. If dopamine receptors are effective, then you'll get tics. These tics can be motor tics, like the eye blinking, or verbal tics. And then another kind of sort of autoimmune reaction is this folate receptor. This is the calcium folinate, Dr. Fry with the leucovorin. So if folate receptor alpha is affected, folate across the blood-brain barrier is impeded, and then you have this low level of folate in the brain, and the brain stops working properly. So these are all slightly different drivers, but you can see a pattern here. Now, to be complete in the presentation, I'll look at some other types of autism. So dietary autism, it definitely does exist. People with very poor diet have deficiencies which you can measure in blood tests, and they can make autism worse. And this is reversible, ideally by changing diet, which may take time, of course, but then you can supplement whatever the deficiencies are. The other consequence of bad diet is you get disturbed gut bacteria. And when you have strange bacteria growing inside you, you get chemicals fermenting that really weren't supposed to be there. So one of them, propionic acid, this is a short-chain fatty acid. You need propionic acid, you need butyric acid, you need all of these chemicals to be present. But if you have the wrong bacteria, you produce the wrong amount of these chemicals, and then this causes an effect on the brain that looks just like autism. So, for example, this propionic acid, if you get a mouse and you inject the mouse with propionic acid, you get the autistic behaviors just from this. So there's nothing wrong with the brain. It's a short-term phenomenon caused by this chemical. And then and the second example in the research, P-cresol, which is a phenol. So it's caused by fermentation of proteins. This has the same effect. This will appear as autism. So you can have autism caused by the wrong bacteria growing in your gut. I think most likely you will have a combination of causes of autism. So you have autism for genetic reasons, plus a bad diet, and the bad diet causes these chemicals being produced, which makes the autism worse. Small intestine bacterial overgrowth, SIBO, this seems to be quite common in autism. It may be overdiagnosed. This is treatable by killing the bacteria, basically. So there's a cheap drug called rifaximin. Well, it's expensive in America, but it's cheap everywhere else. And this can be quite remarkable. Some people need to repeat the therapy. So this is basically killing the bacteria that's growing in the wrong place, or it's the wrong bacteria in the first place. Obviously, you want to improve diet. You want to have fruits, vegetables, and importantly, fiber, because you want this fermentation process in the gut. But for that, you need fiber. And there's different sorts of fiber. The more balanced your diet, the better your gut flora will be. Many people with autism have various gastrointestinal syndromes. So it might be reflux when the acid's coming up that shouldn't be there. And then this causes inflammation of the esophagus. It makes the child have pain. It makes them cough. But they can't express their symptoms. So then often this doesn't get treated. So any kind of GI symptom, you need to treat it. And you should get a positive effect. You need to critically evaluate food allergies. There are various tests available that will tell you that everyone is allergic to everything, which is not true. So you can buy a test that will definitely tell you you're allergic to something. Some of these tests are not really scientifically valid. But if you do have genuine food allergy, avoid the food. You can't always do that. One therapy people use is cromolyn sodium, which is a mast cell stabilizer. It's important not to be deficient in important vitamins known to affect autism, one of which is vitamin D, which is really basic. And yet in some countries, and it's particularly hot countries like Egypt, many children with autism have low levels of vitamin D. And you think, how can that be? Well, if you are dark-skinned in a hot country and you cover up or you stay inside all the time, you will not produce enough vitamin D. If you have pale, white skin like me, you go out in the sun, you don't need long to produce vitamin D. This fecal microbiota transplantation, FMT, this has been shown effective, and it gives a long-term benefit to those who have autism and really troubling gastrointestinal symptoms. So this is effectively taking the bacteria from the healthy person, putting it in the child with autism, and then it at least solves one of their problems. Because if it solves the GI problem, the autism itself should moderate. I just put in yellow this other point because in some cases, something as simple as a mold or fungus in your house can produce symptoms of autism in a child. It's probably extremely rare, but it is documented, it can occur, and it is reversible. So, if someone moves house and suddenly develops autism, you have to wonder, is there a link? And all kinds of things can be involved. Now, according to Dr. Kelly from Johns Hopkins, most people with regressive autism have mitochondrial disease. Now, mitochondria, this is the, if you like, the power pack of your cells. So the mitochondria convert glucose to ATP to power your cells. So ATP is what you need to actually move your muscles or think, basically. Now, what most people don't realize is that in very young children, up to 2/3 of the calories being used at rest are consumed by the brain. So the brain is hugely hungry for power, and this actually makes it extremely vulnerable to any disruption in power. Because what happens in mitochondrial disease is that the enzymes that are used, they're given nice simple names, complex 1, 2, 3, 4, 5. These are the chemicals that are used by the brain to take the glucose and make it into ATP. And if you have any genetic or other problem in producing those enzymes, you may not be able to convert the glucose to the ATP. Now, if this happens at a critical point in the brain development, say at the age of 2 or 3, you have the effect of like a power outage. There wasn't enough ATP produced, and then some neurons die, and then on some axons, the myelin is destroyed. So there's a combination of permanent damage and temporary damage. You know, you can fix the myelin layer. Once the neuron's died, it's gone for good. So what Dr. Kelly has told us is that you need to protect the brain. So if you've had a regression in autism, your child's 2 years old, they've lost their speech. He has his therapy here, and what he's aiming to do is minimize oxidative stress using various antioxidants and maximize the production of complex 1, which is normally the enzyme that's lacking. And then you hope that you don't have a second regression, and you also hope that the brain manages to recover from the first regression. Now, normally there's a trigger. So it might be a your child might be 3 years old, they were sick, they had a viral infection, and then autism got worse. After the age of 5, it's almost impossible or unheard of to get regressive autism. And the reason is, go back to this chart here, after the age of 5, the brain gradually requires a smaller and smaller and smaller percentage of the body's energy. So the brain becomes less hungry. If whilst the brain is growing, you have this power outage, brain is damaged. According to Dr. Kelly, some people make full recoveries, but of course many don't. And there really are no very potent drugs to treat mitochondrial disease currently approved. In the research though, of course that's what I'm looking at, I found quite a selection of interesting drugs that might well be effective in improving the health of your mitochondria. One of them is an old cheap one called sulfalam, and now in the research it's been shown to block mitochondrial, reactive oxygen species. So it's improving oxidative stress in the mitochondria. But it's a drug to treat a dry mouth. Then in the research you can see what is triggering the development of mitochondria. Because your neuron, once it's dead, it's gone. But within each cell you have many mitochondria, and they are developing and dying all the time. So the master regulator of the biogenesis of mitochondria is called PGC1 alpha. So if you can activate that, you will make more mitochondria. And there are, in the research, various ways to do that. You can activate PPAR delta with a common drug called telmisartan. There's a drug used to treat psoriasis and now multiple sclerosis called DMF. That has been shown to both increase the number of mitochondria and increase complex 1 expression. And then we have this interesting drug from Latvia, back from the days of the Soviet Union, called meldonium. And this also increases expression of PGC1 alpha. And they're not totally sure why it does it, but it does do it. That, I think, really someone should be investigating, but nobody is. Then you have the choice of bypassing complex 1 using the ketogenic diet. If you recall, we're normally trying to convert glucose as our fuel into ATP. If you use the ketogenic diet, you aren't using glucose, you're using ketones. And if you use ketones, you bypass complex 1, you don't need it. So that's another interesting therapy if you genuinely do have mitochondrial disease. Also, you can reduce something called nitrosative stress in mitochondria. So this also is potentially beneficial, and remarkably, what does that? Leucovorin, calcium folinate. So as well as improving folate levels in the brain, it will reduce nitrosative stress in the mitochondria. So another reason to try it. And then again, we have this interesting antihistamine from Russia called Diamox, which has been shown to enhance mitochondrial function. And it was seen as a therapy for Alzheimer's, but it failed in the trials. But frankly, so what? Because Alzheimer's brains are old and they are severely impaired, whereas most children with autism, their brain is actually very healthy. So the fact it didn't help in Alzheimer's, I think, does not tell us whether it would help in autism. Now, another comment on allergies and mast cells. So, and comorbidities. So when you're understanding your autism, many people with autism have comorbidities like eczema, asthma, pollen allergy. In the extreme, you can have mast cell activation syndrome, and even juvenile arthritis. You think, why? What is Peter talking about that for? Well, if you go back to the original paper from 1943 from this American psychiatrist Leo Kanner, when he was introducing the concept of autism, subject number 1, Donald Triplett, who was tracked down later, and here's a picture of him on his golf cart. He developed juvenile arthritis. His autism became much, much worse. When his arthritis was treated effectively, his autism improved substantially. He even went to college. And I don't know whether he's still alive, but 5 years ago he was. So we conclude really that autoimmune conditions make autism symptoms worse. And it's fully understood why. These pro-inflammatory messengers like IL-6, they're circulating and they reach the brain, and then the brain loses its homeostasis. So how do you treat allergy, mast cells? Well, these are existing drugs, mast cell stabilizers, cromolyn sodium, azolastine, it's useful as a nasal spray, rupatadine, ketotifen. Some of these are very cheap. It depends where you live, what the price is. And then there are many natural substances. These are promoted by Professor Theo Harides at Tufts University in the US, so luteolin, quercetin, rutin. And one of my favorites, obviously, is the calcium channel blocker verapamil. So what about genetic testing? If it hadn't already, the presentation hadn't already got complicated enough. It's not as useful as you would expect. It definitely has greater potential, but again, you have to do a lot of the work yourself, which shouldn't be the case, but it is. So again, remind yourself, one of thousands autism. Yours is specific. You want to treat your type. It doesn't matter that some therapy is effective in someone else. It might do nothing for you. You need to be You need personalised therapy. So I was contacted by one reader of my blog some time ago, and his child is now an adult. Autism wasn't really treated, or was never treated with drugs. But he showed me the list of genes that were identified several years previously in whole exome sequencing. It's quite unusual because there's 17 of them, and all of them, in my opinion, could cause autism. What normally happens is you get the results back from the laboratory and you can't figure out which one or ones are relevant. Here we're spoiled for choice because they're all relevant. Now, you'd have to read this at your leisure after the presentation, but these genes, when you look what they actually do, they are very much related to fat, cholesterol, metabolic syndrome, and specifically one of them, DHCR7, which I mentioned earlier when I spoke about simvastatin. If you have 2 faulty copies of this gene, you will get this severe autism called SLOS, which is also likely to have other effects beyond autism. You've got 2 genes here that relate to methionine synthesis. These are marked in yellow. And you have the gene here that encodes GLT1. If you recall, I told you that penicillin has a good effect on some people with autism because it increases expression of GLT1, which is responsible for taking glutamate from synapses. Well, this boy, he has a genetic disorder in this very transporter. So quite likely he has reduced expression of GLT1. The vitamin D receptor that I mentioned, those children in Egypt often having low levels of vitamin D. And this young man has got a genetic dysfunction in the receptor for vitamin D. But what really struck me was how many of these genes reflect cholesterol, triglycerides, metabolic syndrome. Then we have the oxidative stress gene, GPX1, so many. But many of these are treatable, because if you look at MTHFD1, this definitely will cause severe autism. But it's treatable. And what's it treatable with? Folinic acid, leucovorin. So I produced this list of possible therapies. I didn't, go into it in enormous depth. I didn't spend days and days. I spent, a few minutes per gene. But I came up with so many therapies that are definitely plausible. And many of these therapies are actually mentioned in my blog already. So there's nothing unique here. Now, what would be the result of giving an adult these therapies? I don't know. I mean, ideally, you would have given these therapies much, much earlier. But from what I've seen on my blog, I mean, I've got 13,000 comments, so conversations, if you like, with people parents around the world regarding their children with autism. It's clear that adults with autism can be treated. So it's never too late. But the sooner you start, the better. That's for sure. Now, the obvious question is, from a parent's perspective, is where do I go for treatment? I had a conversation with a business school friend of mine a few years ago, lives in Australia. His son has severe autism. He just said, where do I go? Who do I pay? Unfortunately, it's not as simple as that. There is no one-stop solution. It doesn't matter how much money you've got or where you live. Generally, doctors are not helpful in any country. They regard autism as untreatable. And they really give a hard time to parents who do try and treat it. I had this message a couple of weeks ago from a lady who was asking me, she was actually asking me about ADHD rather than autism. And I said, start with treating the autism, start with Bometonide. And she wrote to me and she told me that she's seeing some lovely gains, but I don't want to tell the pediatrician because they'll go bananas and think I'm mad. And this is what happens. You even get doctors who are really quite threatening. I had another lady, this one was in Australia, and she had a wonderful effect on her daughter with autism, totally transformed her trajectory. And she told me that when she goes to her doctor and mentions these things, the doctor told her, look, you know, if you take these drugs, you might kill your child and you'll go to jail for the rest of your life. And of course, what's the mother supposed to do? But at the same time, the same doctor says, but if I had a child with autism, I'd do the same as you. So it's a bizarre situation. And as I put here in my presentation, I have readers of my blog who are professors of medicine, neurologists, pediatricians, and primary care doctors. But all of them, they have a child with autism. They're not reading about this because they want to treat, you know, their patient with autism. They're treating their child. And because it's their child, they look at it completely differently because they know that if they don't treat the child, the outcome is not going to be good. So parents are in a difficult situation. If you have the money, doing the whole exome sequencing or whole genome sequencing may be helpful. I'd say 30% chance. But then you still, like the father of the adult with all those genes that were dysfunctional, you've got to find a doctor willing to actually read those results and actually prescribe you something because they don't want to. The result is you have to be actively involved yourself in trying potential therapies, looking for ones that are beneficial. Clearly, most parents are frightened to do this. But then you've got to consider what's going to happen if you don't. So of course what happens is people treat autism with what they can access. So they're treating it with diets, homeopathy, supplements. And in some cases that's enough. There are people who by changing diet have solved the problem. Unfortunately, if you have really severe autism, that is highly unlikely and you will need more potent therapies. But in the meantime, what can you do? Well, you need to learn more biology, this is what I did, and read the literature. And there are simplified versions of the literature. You can read my blog. There are plenty of things you can do. What you can't do is rely on someone else to do it for you, because that doesn't exist anywhere, unfortunately. So conclusion, I mean, I was asked by the organisers to talk about repurposing existing drugs. I've done that. You can repurpose them and it can yield great results, but trial and error is unavoidable. Do not expect perfection. If you have a severely autistic child, it's unlikely you can make them into entirely neurotypical. But great strides are possible, improving cognition and reducing these troubling symptoms. Some types of autism are much easier to treat than others. Some people are lucky. You know, they kill off the bacteria in the gut with rifaximin, change diet, everything's fixed. Wonderful. Do I believe them? Yes, I do believe them. Is it common? I doubt it. Then you have these long-known treatable inborn errors of metabolism that no one tests. If you go to the site treatableid.org, you'll see them. You know, why are children who have an autism diagnosis not screened for all these treatable conditions? The reason is the chance of actually identifying the condition is very low. You know, it might be, you know, 0.01% of children with autism have this treatable condition. But then if you don't test for it, you'll never know whether the child's got it, and then their entire life is wasted because they weren't treated. And one of this is relates to biotin. Biotin's another B vitamin, and your body has to or wants to reuse biotin, and it needs this enzyme called biotinidase. And in one blog I wrote, there's a study. We had a Greek boy who was regarded as severely autistic, and then fortunately was in a clinical trial where they tested him for this enzyme. They found it was deficient. They treated him with very high dose of biotin, and then he was no longer autistic. Now, this obviously n equals 1 of 1,000 autisms. It's rare, but it happens. What is autism? Autism is a collection of rare conditions which grouped together becomes a significant problem. So testing obviously is a good idea, but the chance of actually getting something useful is low, but that doesn't mean you shouldn't do the testing. What you do need is luck and perseverance, and you've got to be resourceful. Thank you. And Udachi.